Hey YouTube, I was just making a updated video. Somebody had left a comment and they wanted to know how was my progress going on the hydroxychloroquine. So I've officially been taking the hydroxychloroquine now for 9 months, and I'm doing okay. I just had a checkup on, let's see, December 6th I'm sorry, not December 6th, but January 6th with my rheumatologist. Um, she told me that now, since I've been seeing her for um, a complete cycle of 9 months, and I've had actually 4 checkups. So she told me at this point, I just need to see her once a year. She told me that I'm stable. My labs look good. My platelet count is good now because, like I said before, my platelet count used to be like 450s, 420s, stuff like that. And she considers that a sign of inflammation. And then also my AST count, which is has to do with your liver. Mine was like 42 and 45. So she said that was high, and she wanted that to be lowered, and the hydroxychloroquine took care of that. So now my AST count is like 13, 15. My numbers are really, really good. Um, my CK, my creatinine kinase, that one is somewhat elevated sometimes. Like every time I get it done, the level is like 200 something. When I had to go to the emergency room a few months ago, it was like 600 something. So she wanted to retest me then, and that's when they redid all my blood work. And everything was okay. It was back down to the 200s. But your CK level can be elevated as far as anything. I mean, if you do a rigorous workout, your CK level will go up. If you fall and bump your knee, your CK level can go up. So it can go up because of any type of musculoskeletal injury or anything like that. So as you can see, the hydroxychloroquine does make me itchy. Um, Whenever I'm in a flare up, I tend to itch. Typically, on my legs, it'll be like my thighs, and not so much my calves, but it'll be like my ankles will itch. And sometimes my arms itch just a little. So that's one side effect that I am still experiencing. Um, I am having hair loss, but not anything. How can I put this? I mean, this is all my hair. So to somebody that, if you look at me, you'd be like, you got plenty of hair. But I know my hair, and I mean, I'm losing hair, but it's not like at this major rate. But it's like, hey, I mean, I'd rather be healthy and, have all this hair versus having a whole lot more hair and I'm unhealthy. So you gotta balance it out. Um, Let me see. Another side effect. I'm not really having much of any other side effect that I can think of right now. I mean, only really the itching, mild hair loss. My flare ups, like when I first started the medication, um, I was having like almost 2 to 3 flares a month. And these flares would last anywhere from 7 to 10 days. So, when they would last from 7 to 10 days, the last 3 to 4 days would be like the worst. And the way that I knew I was in a flare up would be like my lower, like my SI joint on the right side or the left side. It would hurt. It would feel like sandpaper like on either side. That's how I knew I was in a flare up. My skin would change. I would get my skin would just like totally change. It would like be like my pores would open up, like on my forehead, my cheeks. Um, of course, increased joint pain, extreme fatigue. Like I would be in the bed for about maybe every now and then 3 days. But most of the time, it'd be like 2 to 2.5 days, and I would be extremely exhausted. Like I could lay in the bed and it just would not be enough sleep. And then I would get really severe night sweats to the point where, I would wake up and it would look like I had worked out. I mean, like my thighs would be wet, my shirt would be wet, my neck, my face. I mean, it was horrible. So that's how my flare ups were. Now, when I have a flare up, I still have the night sweats, but it's not so dramatic. It's like I'll have a little bit of sweat, kind of here or something like that. A little bit of sweat, in between my legs, just a little bit. I'll have slight, joint discomfort, but the joint pain, when I say discomfort, is like it just like it doesn't stop. That's what I mean by in a flare up. Like the pain doesn't go away. Like the pain medication won't work because I take Tramadol. Pain medication won't work. Tylenol won't work. I can't take ibuprofen because I had ulcers from taking too much ibuprofen. So when I'm in a flare up, like nothing really works for pain. So that's another sign when I'm in a flare up now. Nothing works for pain. I still get fatigued, but not as bad as it was. But when this happens, now my flare ups are maybe like once a month, maybe once every 45 days. It seems like it's getting less and less and less. My last flare up, I think it was maybe about 2 weeks ago, 3 weeks ago. I don't really remember. So, the medicine works. I mean, it's doing really well. And what I did was every time I go to the doctor, I always read over the notes. So, she did note in my chart. She was like, she put in there that, that I am stable on my meds and stuff like that, and that she didn't need to see me for a while. But she did put that I do have the owner deviation, and she said if it does get worse, by the next time she sees me or anytime in the future, she's going to add methotrexate. So this is what she's talking about. Now, this hand isn't that bad, but this right hand is the problem. And this is my dominant hand. So she was like, it's red and stuff. So she's, I saw it in her notes, and she was like, I just hate the way that looks. Ugh, I hate it. This hand is not so dramatic, but Lord have mercy. But she was like, she put a note, she would have to put me on methotrexate. She would add that. Let's see. Besides that, with the UCTD, I mean, I'm pretty stable. And like I said in my last previous video, my rheumatologist, she says that I look more rheumatoid arthritis. But we'll see. I think I have lupus, but she thinks I have rheumatoid. She said I look more rheumatoid. I look more on the rheumatoid side of things, but we'll see. So that's the only update that I have as far as the UCTD. I'll be making another video for the the other things, because I like to keep the stuff separate, because I don't just deal with one issue. So I might be stable in one area, but I might not be stable in other areas. So I'll still have other stuff going on amongst other things. So I like to keep it kind of separate. So my next video, I'm gonna be going over the other stuff. So I hope I answered the viewers' question about how I'm doing and any updates. So that's pretty much it. I'm trying to think if there's anything else. Nothing pertaining to UCTD, but I have a lot of other stuff going on. But as far as UCTD, no. Oh, she did tell me that next time I won't be seeing her when I come to the doctor. I'll be seeing the nurse practitioner because I'm stable. And so she'll just be like running labs and stuff like that. So I'll only be seeing her once a year. Next time I see the doctor, it'll be the nurse practitioner. So if anybody has any more questions, please ask, and hit me up. Hit that like button. Hit that subscribe button. Y'all have a good night.